All right, you guys, you ready to have some fun? Thank you for coming, everybody. Happy Tuesday. Thank you very much. So it's going to be kind of weird talking into a microphone tonight, but we're going to do it, okay? So my name is Dr. Cade. Thank you again for being here tonight. We are going to cover some stuff that I learned just a little bit ago from Mr. Harry Grimm over here. Thank you, Harry. And changed my mind actually really, really quick. I couldn't believe how much better I felt after doing this. And after being in practice for 7 years and learning something new that changed my mind so fast, I was really, really excited about it. So again, thank you for being here. I've got a lot to talk about before we really start the show. Harry's going to go through a couple exercises tonight and go through the details of foundation training. But I'm going to cover a little bit of the why. Do I've got your blessing to do that? All right, there is my family. We've got 3 now. We've got 2 little boys, Curran, Crew, and Kai. And, you know, I love you all. And I actually wear this line out all the time. I love you all, but I love them more. I would much rather be at home with them, right? But I have a purpose inside of me to come out and share this stuff with you because I've seen so many people over the 7 years of practice that don't realize how good they have it until they lose it. Does that make sense? Health is the most important thing that we have. And we're blessed with 3 healthy kiddos, and we want to keep ourselves healthy for the rest of our life as long as possible so that we get to enjoy them. And again, today we want to bless you with the knowledge and the action steps so that you can have that too. So I founded Life Strength Health Center 7 years ago, and our purpose in the community is right there. Our purpose and what we do day in and day out is to guide and support others to their optimal well-being through education and lifestyle medicine. So again, tonight being out here and educating is huge for us. Our philosophy in the office is optimal well-being achieved not by fighting disease, but by building health. I think we have so many commercials and so many foundations that are all about fighting stuff. You guys notice all about that? And I don't think we're getting too far just by fighting stuff. And so tonight we're going to talk about building health. So inflammation, how many of you, we're going to jump into it right now. How many of you have heard the term inflammation before? All right, good or bad? How about we do one of these? You guys don't hear me talk about that too much. So you're going to hear a common theme tonight. The body is created to heal itself. The body's smart. The body is never stupid. The body always makes an intelligent decision. So inflammation short term, acute inflammation is actually a pretty smart thing. The body does certain mechanisms to heal. But if it stays there for a long time, that's when it turns bad. And so that can happen in the cardiovascular system, that can happen in the brain, that can happen anywhere in the body. And when it stays there longer than what it's called for, that's when inflammation becomes a problem. So where does inflammation come from? Anybody have any ideas? Throw it out there. What was that? Nervous system, sure. It can come from the nervous system, sure. It's what controls all of it and how much to create and when it should go away. Give me sources of what could cause inflammation in our day-to-day life, though. Food, love it, bonus points. And we're at Food and Thought, of wonderful story here of things that will decrease inflammation, right? How about anything else along those lines of food? I don't want to keep you here all night. Come on, spit them out. What?
Some medication?
Sure, medications, toxicity. How about we put it in that category? Here are where I think the big categories of inflammation come from. Of course, how many of you ever had mental stress, right? Getting in a car accident, losing a loved one, financial distress, right? Working in a job that you dislike. Mental stress is so big, and I don't want to overlook that one. Food, toxicity. The big ones that we're going to focus on tonight are going to be movement and structure. And so these 2 things, let's talk about movement. There's 2 ways, right? If we move the wrong way, that can cause inflammation. If we don't move and exercise enough, that can cause inflammation. And but again, the movement and the structure, those are the 2 that we're going to focus on tonight. How it leads to pain and how actually the solution is right there. If we correct these things, we don't have to live with the symptoms of that for the rest of our life, okay? So keep that term inflammation in the back of your mind and those 5 sources. So starting with structure. Ready to rock? All right, let's do this. Graphic picture ahead. Cover your eyes, graphic picture ahead. Okay, have you ever seen the commercials that's for Tylenol or for Advil and for aspirin and for all these different things that talk about the aches and pains of getting older? Raise your hand if you've heard about all these. And how about those people that were just moping around, and then they take the medication and they're able to garden all day, right? You've seen those, right? So, the thing that just makes me so frustrated is that we're being sold on this lie that arthritis and degeneration is just a normal part of aging. What do you guys think? Is that a lie that you want to buy? I don't want to buy that lie, and I want to break it down for you as to why it's very common in our day and age. Remember the sources, right? Those sources are getting worse and worse for most people, but it doesn't have to be the case. So what is this? This is a skeletal system, isn't it? And so these are bones. This is a skeletal system. And we don't know how old it is. It could be hundreds, it could be thousands of years old, but this is the last remains of this galloping animal. And so if you think about it, if the skin's gone, the muscles, the tendons, the organs, everything's gone, the last thing that we have left is the skeletal system, right? And if it's alive, I shouldn't say alive, but if it's there, right, after hundreds or thousands of years, are you guys okay with it degenerating in our alive body? You guys think that there's kind of some misdirection there, disconnect there? So let's talk a little bit about it. How many of you have ever heard of Wolff's Law? All right, let's go back. A law is not a good idea, not just a theory, but a law happens every single time. Anybody want to give me another example of a law? Huh? Murphy's Law, I like it. I was so not expecting that. I've got nothing clever to say to that. Okay, gravity. How about the law of gravity? If I drop this, never has there been a documented case, right, where it floats under normal circumstances, or I drop it and it goes up, it's always going to fall. That's the law of gravity. So when I say Wolff's Law, this means that it happens every single time in every single one of us living beings, okay? So what Wolff's Law says is that the bone in our body adapts to the load stress. That makes sense? Under less load, it's going to be less strong. Under more load, it's going to be more strong. Does that make sense? That's literally all that Wolff's Law says, and it happens every single time. So you're going to see me go through a couple of these x-rays like this, and it's going to precurse what Harry's going to talk about. You guys see this bone up here, how it's nice and square, and you see the space above the bone and below the bone? That's a normal joint. Make sense? You see the changes that happen to the ones below. You see how the space between the bones are much less, and you see the shape of the bones are much less. Are you willing to bet that those bones and those joints are the same age? They're in the same body. They're the same age. Why are some degenerating and wearing out faster than the other ones? Wolff's Law. And so the way that this works, when there's an area of injury, whether it's overuse or an accident or something like that, it starts with inflammation. And remember we said inflammation's good. But if it goes unchecked, it turns into scar tissue, and then it turns into arthritis, and then it turns into degeneration. And that's what we're seeing at these joints here, Wolff's Law. So here's two more examples. Here's a normal spine on the left. You see the shape of the bones. You see this and the spaces between the bones on the left, normal physiology and structure and movement of the spine, and you see what it looks like on the opposite side. These people are the same age. These joints are degenerated and look like that person's 120, and these joints up here look like it's somebody who's 50 or 60. Isn't that wild? Isn't that wild? Why is that happening? Well, here's an example right here. I'm going to do a motion, a time lapse, that would be the right word, a time lapse of x-rays. And what I want you guys to look and see here is the normal structure of the curve. And as we lose the structure of the curve, you guys are going to see changes in the shape of the bone, and you're going to see changes in the shape of the joints. So I'm going to go through it right there and watch that happen. You guys see how it's losing that curve? And watch the front of the bones here. Watch how they develop these bone spurs off the front. Watch the spaces between the bones get smaller and smaller and smaller. Remember, the body is adapting to the stress. It's falling forward. It's putting more bone in the front to protect itself and prevent it from getting worse. Look at the spaces between the bones getting smaller and smaller. Look at this one, almost just getting squished. It's no longer square. It's in the shape of a rectangle. Remember, this isn't stupid. This is how the body adapts to stress, okay? So let me stop really quick here. Do you guys have questions about what you're seeing so far? That's a neck. So how many of you living here in Naples, Florida, have seen little old ladies and little old men walking around like this before? And they're walking around like this, and you ask them to look up, and they look up with their eyes, right? They can't bend up because it has degenerated so far to the point where that joint is no longer moving the right way. All right, now I got to start talking a little bit faster here. Another example of an x-ray, normal bones, normal joints. Down here, you see the bone spurs happening and connecting to each other. Okay, so let's manage some expectations. Obviously, this takes years and years and years to form. You guys saw a time lapse of years of damage being unchecked, turning into something that's very, very hard to reverse. For that to take place, somebody's got to ignore a lot of warning signs, aches and pains and loss of motion and terrible, terrible posture. Again, this is something that we can work really hard to prevent, but once it gets to a point that's bad enough, we can't really reverse it. Okay, you guys see what that looks like? We really can't disconnect those bones. That's when it turns into something like surgery. How many of you know somebody that's had spinal surgery? How many of you know somebody that it's turned out pretty good? How many of you know somebody that's turned out pretty bad? It usually doesn't turn out very good. It usually does not. So I'm going to take this to the next level. Let's talk about function, and then we're going to hand it over to Mr. Harry. Did anybody make it to the Upgrade Your Brain Power Talk? Okay, that's good because I think it did this for a lot of people. It was something I was so excited about it. I learned so much when I was doing the research about neurology and function that when I shared it, I definitely went overboard. So I'm going to sum it up because I see so many times that we separate the bones from the neurology, and I want to stop that, okay? I want to make sure that when you guys hear what Harry has to say in talking about structure, that you relate it to the function and the health of your system for the rest of your life, okay? So we know that the brain controls everything. We know that the brain coordinates all sensation, all of our ability to think and comprehend, and it also controls all the nervous system activity, telling our heart to beat, our lungs to breathe, our immune system when it to work, okay? I love this. The founder of chiropractic said every organ in your body is connected to the one under your hat. Can I just take that a step further? The health of every organ in your body is determined by the connection to the one under your hat, okay? You guys see how I'm starting to tie this together now? This is a picture of a nerve. This is a bundle of nerves. Isn't that absolutely amazing? This is one that goes down your leg. We'll just pretend. And you see how there's all of these different little nerves inside of that big bundle. And one might go to tell this hair to stand up or to lay down. It might go to regulate the sweat gland. It might go to the muscle. It might go to the muscle that controls the circulation from expanding or contracting. Is this absolutely unbelievable? Now, if we zoom in on this, there's a blood vessel inside of that. And here, these are blood vessels. And look at the blood vessels having even smaller nerves telling those blood vessels what to do. Isn't that just mind-blowing? You know, every cell in our body is under direct control by the brain and the health of that system. It takes it to the next level by saying the greatest doctor in the world lives inside each one of us. We want to make sure that doctor inside of you is working at its best, telling everything what to do. Normal x-ray over here. Let's transfer the idea of just function one step deeper and talk about what it's doing to the communication system, the nerve system. You guys see we've got a curvature here, and you see how these bones are really hard to tell where one bone starts and the next stops. You see how they're kind of just all melted together? That's not a very healthy spine. A lot of degeneration. Tony, this is Tony. Tony can't move very good. He's got a lot of pain. Tony, here's his MRI. You guys see what we're looking at here? Here's the curvature of his neck from the side. Here's the segments of the bone. This right here is his brainstem coming down and turning into his spinal cord. And you see this white stuff here? This is white stuff is actually the insulation. Just like this cable, this power cord here has insulation protecting the electrical activity inside. The gray part there is the electrical activity surrounded by the fat. Do you see the structure of his neck is actually putting pressure on the neurological components of his nerve system? Isn't that crazy? So when our structure is having damage to it, it directly correlates to the function and the health of our nerve system. What is the real cost of ignoring those symptoms and ignoring a loss of structure? Again, how many CVS's did you guys pass by on the way here? How many Walgreens did you pass by? I ask that every single day because it seems like they're putting one up on every street corner. It's absolutely unreal. So last couple slides that I'm going to go through is a medical journal, Spine 2005, took a study of 752 people, and they studied how far forward their head leans forward. You guys see, I probably shouldn't stick my butt out. How about this? How far forward their head goes. And they said that of every single person, if it was even just a millimeter, right, it said every measurement of their health status declined for every millimeter that they went forward. Every single one of them, when they lost their structure, they got sicker and sicker and sicker. Of course, being a medical journal, what did they say? This isn't good, but we recommend surgery. If we take this to the next level, here's an example of a spinal surgery. For people that have the symptoms and damage to their structure, the likelihood of getting surgery for those symptoms when they first touched a chiropractor was 1.5%. The likelihood of getting surgery when their first touch for those symptoms was a medical doctor or a surgeon, 42.7%. Is that unbelievable or what? I don't know about you, but I would do anything to prevent that from happening to somebody, even my worst enemy. So a couple more things here. Dr. Roger Sperry won a Nobel Prize for learning and proving that 90% of the stimulation and the nutrition to the brain is generated by movement of the spine. When we move the spine, it actually increases the flow in the food right, to our brain. It's absolutely unbelievable. So again, when Harry comes up, we want to make sure that your spine is moving and your brain is getting stronger and getting healthier every single day. To tie up what I'm talking about, again, when we have an unhealthy spine, that literally scientifically means that we have an unhealthy brain and nerve system. We want to get your spine healthy so your nerve system and your brain can be as healthy as possible for as long as possible. And we have to stop calling it, muscle or ligament problem or a bone problem or a neurological problem. It's together. It's a neurospinal organ. That's one piece. You take nothing else from here tonight. Please remember that and why it's so important what Harry's talking about tonight. So again, if our spine isn't healthy, I don't know about you guys, but the worst nightmare that I have personally is my wife forgetting my name. Looking into her eyes, that's the worst nightmare that I have. And so we understand that when we put our hands on people, when we change their posture and their structure, we're working on preventing diseases like this every single day, okay? So I hope I've just started to kind of shift your lens a little bit and look at this through a different filter. Harry, I don't know if you were expecting all of that tonight, but that's where my brain goes. And again, it's not just an exercise that you're going to learn tonight. It's not just about good posture. It's about the health of your system forever, okay? So we've got a quick video that we're going to play from the founder of Foundation Training, and then Mr. Harry Grimm is going to come up. And Harry, I just want to say thanks, man, for taking the time to be out here tonight and to teach these people. This is a free resource that Harry's got tonight. He's got classes and clinics that we'll, of course, talk about afterwards, but pick his brain tonight. Please give him a hard time for me, okay? So here's a quick video, and thank you guys for hanging out with us tonight.
Our culture is responding to pain and injury all wrong. We're taking chronic, repetitive movement breakdown patterns that lead to back pain and lead to plantar fasciitis or carpal tunnel syndrome or thoracic outlet syndrome, and we're responding to them at the symptom level. We're filling your body with chemistry that has so many side effects just to mitigate a signal, to stop your brain from knowing what's happening, not to stop your body from producing what's happening. We're responding to herniations by sealing up the spine surgically instead of restoring proper functional movement by strengthening the posterior chain. We're taking syndromes and becoming victims of these series of symptoms that are misunderstood, not diseases. These are simple movement breakdowns that you can fix, and it's your responsibility to fix them. The doctor can't do it for you. I want you to learn foundation training. I want you to strengthen your posterior chain, and I want you to improve your quality of life through movement, because I know how possible it is. I do it myself every day. I hope this message rings true for you. I hope you take advantage of how much control you have over your quality of life, and you start improving it now.
First of all, I want to thank Dr. Cade. I've probably contacted, I don't know, let's say 100 chiropractors in the area in the last couple of years, trying to teach them a little bit about foundation training, what it is and why it's so good, and why I'm so passionate about it. First guy that ever wrote me back. In fact, he wrote me back and said, your email didn't come through, send me the rest of it. And so we've been working back and forth now for a couple of months, or a month and a half or so, and this is the culmination of those meetings. And I've got to give him a lot of credit for being open-minded enough to take a chance and listen to me, because foundation training to me is something everybody everywhere should learn. It's something for everybody. All right? It helps athletes. We help right across the board, from professional and Olympic athletes to the couch potatoes and people in so much pain they can't get off the floor. We find the same mechanical breakdowns across the board. We've helped professional athletes become better athletes. This is Dr. Eric Goodman. At age 25, he was recommended for back fusion surgery while in chiropractic school. He didn't think it was a good idea. And then he also thought if he's going to be a doctor, he wants to help people. He doesn't want to be able to just send them off, go, I don't have an answer for you. So he became obsessed with finding a natural solution to his pain, and he was in a lot of pain. He developed foundation training over several years, and he just started showing it to some friends who then told friends who then told friends. Being in Santa Barbara, he ran into a lot of the media, the stars. He worked with a bunch of stars and things like that. And his first book came out was, his foreword was written by Lance Farrell, just before all the information came out. Was it Lance Farrell? No. Armstrong, that's the name. Lance Armstrong. So he was kind of like, well, it's okay, the book is out. But he's written 2 books. He's had a couple of programs out, and his new online program is online now. And it has all the training videos and exercise and things like that you can do. We have a couple hundred instructors from about 23 countries. I got my certification back in 3 years ago, and there was only about 250 of us at the time. And today at 36, he's never been stronger. He's, for the most part, he's in no pain, but let's face it, he's 36, he still does silly stuff. He's a surfer. He lands on his head a lot. He's probably not that great a surfer. All right, but he's not in pain unless he does something like that, but he knows how to get himself out of it. My background, I'm the first instructor in Collier County to be certified in foundation training. And let me tell you, trying to get people to listen to you is about something new and about something simple that can get them out of pain. It's not an easy road to go down. Somebody said, aren't you glad you're the first one? I said, well, if I had 100 people, certified instructors here, then everybody would know what it is. They'd just be calling me. But my background is I've been in martial arts for 35 years. I owned a very large martial arts school up in outside of Worcester, Massachusetts. And we ran that for about, my wife and I ran that for like 20 years. And we decided to move down here a few years ago, about 6 years ago. And my idea for retirement was teach Tai Chi on the beach. I thought that'd be really cool. All right, but I kept thinking that learning Tai Chi properly, because that's the only way I would know how to do it, you'd have to learn the martial aspects and make the timings and everything else. And then I found foundation training. It does in weeks what it takes years for martial arts or Tai Chi to accomplish. Better posture, better breathing, better balance, more strength. And there's only 18 exercises in the whole system, not 106 movements that you keep forgetting. Well, of course, there's more than that, because then you do it from the other side, right? All right. Today at 63, for the most part, I'm in no pain, no aches and pains, just minor stuff now and then, but I know how to get out. I'm on no medications, and I have no problems. Here's our problem when it comes to posture. The heads are forward, and Dr. Cade has gone over a lot of this stuff, so I won't spend too much time here. But you can see, and of course, the cell phone craze nowadays, everybody's just leaning forward and looking into their phones. I've seen people walk into fountains at the mall. Just boom. It's like, okay. We're also collapsing, our bodies are collapsing inward and downward. That's where you see the ribs starting to approach the hips, and the heads are forward. And pretty soon, when you get stuck in that position, there's nothing that can be done for it. We also, the body is supported by the joints of the body. The joints are a secondary support system. Our muscles are the primary support system for our bodies. We have to learn to put the weight of our bodies back into the posterior chain, into the other muscles of the body that were designed to carry that weight. Our glutes are designed to hold us up and propel us, and most of us, unfortunately, use it for cushions more than anything else. They have a challenge with teenage girls blowing out their ACLs. And what they found was that their glutes weren't firing properly because their posture and their weak musculature. Your body communication diminished. Dr. Cade went over that, and it's true. I mean, it's amazing how much you can interrupt the communication between the body and the brain, the muscles in the brain. Gravity's winning if we don't pay attention to it. Our bodies are beautifully designed to work against gravity, but because of our culture, we've kind of gotten out of that. We're sedentary. We don't move as much as we used to. We have a lot of modern technology, modern conveniences and things like that. And I think a lot of it's really great. But we have to be aware of it so we can counteract. Because you can't go to the gym for an hour a day, then sit for the other 8 and expect that you're going to be healthy. You might be stronger, but your body's not going to be healthy. You can't sit for 8 and work for 1 and recoup that. We call it complacent adaptation. That's where we just comply. We find ourselves at the end of the road with poor posture, poor movement, poor breathing. Less efficient movement patterns, more frequent injury. One of the things we do for athletes is reduce their potential for injury and quicken their rehab if they are injured. Forces of gravity absorbed through the skeletal, or like we said before, the joints of the body rather than the muscles. Moving wrong, having an unnatural diet leads to chronic inflammation, which just further compounds the situation. And your visceral organs are not working properly if we're sitting on top of them, not giving them space to work. Of course, we all know back pain is probably prevalent. 80% of the population has a bad back at any given, very often. I mean, just from sitting wrong. I used to throw my back out 3-4 times a year by sneezing. Yeah, I think it's funny now, huh? I do too. But and our lifestyle illnesses, that's just how we live and what we have to do to bring our health back. We have to take responsibility for our own health. Nobody else is going to do it for us. Why aren't people finding relief? And a lot of it is we're using reduction instead of finding about holistic wellness. Reduction just means we're taking a pill to mask the symptoms. We're doing things to mask or prolong, not going to the root cause of what's going on, but fixing the painful foot when that painful foot is being affected by the hip or by the shoulder. We have to look higher up and further away most times. Active versus passive patient role. This is a big one. This is where we've been so indoctrinated by the medical industry that the doctor knows best. Listen to your doctor, and if you don't, he'll take care of you. And the only thing that FDA says, the only thing that cures illness are drugs. I beg to differ. The only thing that cures illness is the body. Innately, it seeks to have balance. Of course, again, modern conveniences and then loading the unloadable body. How many times have you guys been to a gym and you see guys just hunched over with their back just rolled and they're trying to do some kind of a lifting motion? All they're doing is, imagine building a house with a cracked foundation or a weak foundation. It's eventually going to cave in. It's going to fall. Foundation training is an accessory. It does not replace any modality or anything. If you go into a chiropractor, it'll only help what the chiropractor does for your health. If you're an athlete, use it as a warm-up and a cool-down. If you lift weights, same thing. If you garden, same thing. If you sit down and watch TV, the same thing. All right? But posture causes all these things. These are some of the chronic breakdowns you can get from bad posture, bad movement. Foundation training, other side, though. We build from the inside out. That means all the small interior muscles are the first ones that we pay attention to. We get back to deep breathing. Breathing is so vital, and there's hundreds of beautiful breathing methods out there. We have our own. We want to give you effortless posture. Involuntarily, you're going to have good posture because it's going to feel better. More natural movement and more space for your organs and your body and everything else inside you to work. All right, I like to say to people, if I sat on your chest, you could still breathe. But after a while, you're going to have a lack of oxygen. Well, think about your visceral organs when we just sit down on top of them. They're still going to work, but it seemed to me they're not going to work as effectively as they could if they had more space and more room to do their job. Then eventually, when you have pressure, you have friction or pressure, eventually you're going to have a breakdown. All right? I wouldn't take that as scientific, because my background is not scientific. Okay, my background is how to punch people. That's a joke. All right. You're gonna lose aches and pains out of your body. I used to get up in the morning and I'd have to walk back and forth across my hall so my knees warmed up so I would dare chance the stairs going down to the kitchen because I knew I was going to fall over. 20 years later, I wake up, I get out of bed, and I start moving. No aches and pains to speak of. All my chronic pain is gone. I don't know how long it's been gone because when you have pain, you don't pay attention to it. And one day I just noticed, I haven't noticed any pain for a while. Profoundly stronger. We all have latent strength in our bodies that we do not use because we're not using them properly. When you tie the muscles together in chains and use them like they were designed, you're going to get profoundly stronger. And then when you go lift weights, you're going to have a much better experience. Then when you go play golf, your hips are going to be open, level, strong, and free to move. Because we all know that hip power is basically in any physical activity you're going to do. The better your hips move, the stronger your hips are and relates to the rest of your body, the better you're going to do. Your body just works more efficiently. All right. This is where you guys get to try it. So if everybody would like to stand, if you want to try it, just stand up. And I should preface this by saying that If you feel like you have to stop, please do. This is not about no pain, no gain. This is about learning about your body, learning about how to tie the muscles together, and spending the time to go into the postures and coming out of them is inherently more important in the beginning than trying to hold it. What we're going to look for is some tension and activation in the lower back. So what I want you to do is put your feet fairly wide. Keep the weight in your heels. Pull your chin back like you're trying to make a double chin. Sorry, ladies. All right, eventually you want to have the chin over the clavicle. So as we pull it back, don't look down, don't look up, just pull it straight back. Put your little finger on your hips, little thumbs on the rib cage, and just relax for a second, just relax the head. And then pull that head back. Feel the rib cage rise and expand. All right, so you're going to breathe big into the rib cage. All the air goes up into the rib cage. And I should say, if you start to feel dizzy, just keep breathing or sit down and keep breathing. Because about 1 in 10 people sometimes get a little dizzy. Just breathe everything big into the rib cage and expand the rib cage and elevate the rib cage up away from the hips. We want to have more space between the hips and the ribs at all times. Just bigger and broader. And just relax. We go through this in steps. All right, so little fingers on the hips, thumbs on the rib cage. Now, these are nothing more than measuring sticks to give you a physical touch to feel what's going on. Pull that chin straight back. Keep the weight in the heels. Breathe big into the rib cage. Expand the rib cage. Don't hold your breath. Just breathe big and deep and slow. In through the nose, out through the nose. And all we're going to do from here is you're going to pull the hips back, let the chest come forward. Bend the knees slightly, just a little bit. And then pull the knees. By pulling the hips back, pull the knees back over the ankles. You should feel the lower back activate and the hamstrings activate. Do this if you got that far. Good. Keep breathing deep. All right, take your hands, palm up, and just lift them in front of you, both hands. I can't talk that loud. You just feel more activation in the lower back. Feel more activation in the lower back? Push through your heels. Feel a little more?
Why I feel more on one side than the other.
Good.
Okay.
As long as you feel it in your back, that's all I care about right now. I'll explain that in a second, but that's a very good point. All right. Anybody's back burning a little bit? Good. Pull your hips forward and relax. Congratulations. You just did your first founder. This is how sophisticated this system is. That's why I fell in love with it. My background, like I said, is not medical. It's not personal training. It's martial arts. I focused on movement and power when I'm in my training. And when I saw Dr. Goodman being interviewed by Dr. McCullough, and the stances that the exercises he was using were the same exact stances I've used in martial arts for 30-odd years, it intrigued me. Plus, they did it barefoot. All right, because we want to strengthen the feet too, but we won't get into that today. So keep the feet apart. Keep the weight in the heels. Measuring sticks. Pull the chin back. Feel the rib cage rise. Now, we don't want to arch back. We want to lift towards the ceiling. Pull your hips back. Let the chest come forward. Bend the knees slightly, just a little bit. And then just pull the hips back so those knees go back over the ankles and feel the hamstrings start to fire in the back of the legs. Bring the hands forward. Yeah. Reach for that cookie and pull the hips back. All right? Hips are saying no, fingers are saying yes. Push your heels into the floor. Feel the lower back go more. Drop your hands out to the side. Just roll the thumbs away from the front of the body. Feel it lengthening across the chest. All right? Then as you inhale, sweep the hands forward and reach with the hands and pull back on the hips like a tug of war. Keep that hinge going, though. And then drop it down and open up the shoulders. Open up the chest. Make sure the thumbs are rolled over the top and away. That will, you'll keep the shoulders down. All right? And you're going to feel that lengthening across the chest. I'm waiting to see, there we go. Pull the hips forward and relax. You guys hung out there for quite a long time. Good job. All right, so this is the founder. This is one of our 16 or 18 exercises. It depends on how you count them. But I have a handout with me that has that on it. On my website is a video of how to do this by Dr. Goodman. The challenge is do this once a day for a minute. You can always do it more, too, but Do it for a minute. See how you start to feel different. And then from there, what did I do with that thing? There it is. From there, there's a multitude of ways you can learn.
Harry, wait a second before we go there. How many of you just feel different just with that? I do. I feel way different doing that. I feel way different.
I did a talk yesterday, and one woman came over. We just did just little things like that. She goes, my neck tension is gone. I've had neck tension and neck shoulder pain for years. She goes, I just felt it melt away. I said, cool. Sometimes it's almost magical by giving the body what it needs. But this is not magic. Nothing we do is extraordinarily new. It's just how Eric Copeland put this together and what it does with the way he put it together. So we're just going to be here. You're just going to follow. Just do it like a bridge. All right. It's going to open up. It's not that bad.
Look at how much they're leaning. Isn't that crazy how much they're leaning?
The more you can incorporate this kind of stuff into your life. Thank you, ma'am. Give her a hand. This does not take much time. Once you learn it, you spend 10 or 15 minutes a day doing it, and then you integrate it into the rest of your life. All right? Because most of us hinge from the waist instead of, we should bend from the waist rather than hinging from the hips. How many of you wash dishes and push your hips up against the counter and your back starts burning? All right? But you get tired and you're uncomfortable. Just keep the weight in the heels. Pull the hip back and let the chest come forward. You can stay here a long time. Vacuuming. So a lot of this stuff may be integrated in your daily movements, and that's the ideal way to use it, because when you learn how to stand in, how to do a squat, and do you know a squat? Standing and sitting is a half a squat each. Squats are the best exercises you can do. So when you're watching TV, stand up during every commercial and move around. Pump the toxic stuff out of your body. That's how your lymphatic system is activated by muscle. It doesn't have its own pump system. Now, there's a lot of different ways to learn this. I'll give you some information on this so you don't really have to write it down, but I do small groups, private lessons, private sessions, semi-private clinics, workshops, classes, online training for distance. There's also free videos on my website. There's the videos, the online program, and the book, Dr. Goodman's second book, True to Form. All right. And one of the things that we're starting to move towards is that we're talking about symptoms, plantar fasciitis, carpal tunnel, and things like that, who are symptoms of something else wrong. Well, nowadays we're looking at the back pain being the same thing. It's just a symptom. The body is breaking down. We're doing something incorrect, and the body's asking us to stop. All right? Free videos, there's books, and then, of course, the online program. What's your website address? Website address is harrygrimm.com. I think I have that in the next one. There we go. All right. So there's all kinds of ways you can contact me, or you can contact Dr. Cade, and he'll find me. Yeah, I have that. I have all that information written down for you, but, you know, if you like the picture, that's cool, too. I was at a restaurant one time, and I was sitting there, and after the end, the server, she had a bad back. Her back was hurting, so I gave her my card, and she looked at the card. She goes, I know that picture. I was like, cool, call me. She never called me. I have 2 events coming up, and they're listed on there. At Be Well Natural Health Clinic over on Goodlit on August 5th from 10 to 11:30. It's $39 a person. There's a limit of 15 people max allowed in the class. The same thing the following day in Bonita. It's actually better everyday fitness rather than just everyday fitness. All right, but the same thing goes there from 11 to 12:30. No more than 15 people in a clinic. So I want you to be able to understand this and get it. And with the clinics, you're going to get a manual of what we go over, an explanation of what we go over, all right, that you can download after so you can practice. This is usually the most work you'll ever do standing still. This is a movement practice. Don't let the stationary postures, isometric postures fool you. It will increase your ability to move and function more natural. You're going to pull the body back together. And now, Dr. Cade, thank you very much.
That was awesome, wasn't it? Nice work, sir. Thank you very much. So I just want to touch on a couple points that Harry said. First and foremost, do you notice how he said that the biggest thing is to help you get stronger for everyday things like vacuuming and brushing your teeth and tying your shoe? How many of you ever heard of somebody saying, you know, like I threw my back out sneezing, or I bent over to tie my shoe and I herniated? That doesn't just happen that way, right? That was the last thing that broke the camel's back. So something that I've noticed since I've met Harry, for me, one of my biggest weaknesses is when I'm doing dishes. It doesn't happen very often. But when I do dishes, right? When I do dishes, I always have my hips up against the countertop, and then I'm leaning like this. And I was so frustrated. The picture that you saw of my family, we just got pictures on Sunday. And there's a bunch of them where I'm holding my son, and I'm like this. I'm leaning back in response to the load. I'm creating a new center of gravity, and I'm so frustrated with it. And for so many moms, we've talked about it, right? That so many moms with nursing and holding babies, and oh my gosh, it just breaks it down like we're talking about. So this is going to help across the board with the things that we do on a day-to-day basis. I'm going to challenge you guys. I've been trying to do this for a minute every single day, and it's changed so much for me. I adjust people for a living, so I'm leaning over people all day. And so if any of you come in and you're catching me like this, please yell at me or throw something at me because I need your help. I want to be able to do it for a long, long time. So I love this term. Let's wrap things up with just a couple things here. You can't negotiate with Mother Nature, and that's really what we're talking about. If we're not following these laws and rules that Mother Nature has put out for us, it's not a matter of if we're going to get caught, it's a matter of when. We can't out-trick her, right? We are all made in the same way. And so we got to follow these laws that she's put into place. So here is our to-do list when you guys leave here. Please, please, please get checked. What does getting checked mean? Get your structure checked. Get your function checked. You can do that with a posture exam. You can do that with a set of x-rays. You can do that with a nerve exam. But if there's problems, look and try to find the root of them. And we talked about that reductionist model where you are more than just a symptom. You are more than just a pain. There's something that's causing it. I'm going to also
Can I add in
challenge.
here something for you?
Yeah, please.
One thing cool about foundation training, because I've been approached by, especially a lot of fitness trainers, they go, what do you do for an assessment? I go, I don't. They do it. Your body does its own assessment. And I just want to back up to your question there. Well, I only feel it one side of my back. When I first started doing this, one side of my back was very, very painful. The other's not a thing. I'm going, oh, what did I do? Well, the pain went away after a while, and then both sides got really, really strong. So I found a weakness. My body found a weakness, and it balanced out. That left side of the muscle wasn't going to work until the right side caught up in the posture that I was holding. And that's why you felt it on one side. One side was moving. And you could have been slightly off. One of the things we do in the classes, in the clinics, is help you understand where center is.
So where do those things come from, Harry?
What's that?
Why do those happen? Why is one side there pain on one side versus the other? What are things that we do in our day-to-day life that could cause that?
Well, in my case, I was probably leaning more to one side than the other. Because I had a chiropractor tell me once, your right shoulder is 2 inches lower than your left. I went, nah, you're full. No, it's not, can't happen. And then I looked and I went, he's right. All right, so yeah, it's chronic. It's the breakdown of good posture and not using the muscles properly, balanced on both sides.
And over time, those just turn into our normal, from crossing our legs on one way or sleeping on one side versus the other, right? Or, being right-hand dominant or leaning one way in the car or, all these different things that we do in our day-to-day life just turn out to be our new normal, right? And we don't know those things are normal until we challenge them and we try to change them, which is the whole purpose of these exercises, is bringing your body back to its original design. So I love that you felt that right away, and it already means that it's changing. It's beautiful.
Yeah. It's, we don't know what we do, It's amazing how many aches and pains I've developed as I was doing this. And going, oh, look, I'm getting more balanced. Rather than, oh, no, not another ache and pain, not another pain.
I love it. Okay, so last couple things. I'm going to challenge you guys to get to a class and reach out to Harry. He gave you guys his stuff here, and he gave you a couple different options. And if you can't get to a class, go online. There is, just like he said on his website, a couple different videos. It doesn't take long. So, with respect to the big picture, chiropractic is a tool as a chiropractor. Food is a tool. Foundation training is a tool. Exercise is a tool. Managing your stress is a tool. The more tools you have in your toolbox, the more effective of a craftsman you can be. And so add this to your toolbox and see where it brings you, but don't think it is the savior. Don't think chiropractic is the savior. Don't think food is a savior. More of those things that you do, the better it'll be for you. So there's our contact information. I think most of you know where to find us. And thank you guys so much for hanging out with us. Have a wonderful evening.
you.